It's my pleasure to serve as moderator for this dynamic panel discussion with these dynamic panelists. The goal of today's conversation is to not only better understand the ways in which COVID-19 impacts people living with HIV medically, but to also identify the structural and social implications of COVID-19 on ending the HIV epidemic as a public health crisis. We will begin with presentations by our very capable experts, followed by a moderated discussion, and concluding with questions and answers between participants and panelists. I want to encourage all participants to actively engage the panelists in question and answer, but to do so after the presentations and discussion in case initial questions are covered during those times. While the chat box will be open, please reserve your questions for the Q&A box only to ensure that your very important question is addressed and not lost among the chatter in the chat box. Thank you in advance. And now to the panelists. First, we'll hear from Dr. Stefan E. Wallace. Dr. Wallace is a research epidemiologist and an internationally recognized public health and social justice leader with more than 20 years of sexual and public health experience and more than 25 years of social justice and community mobilization experience. Dr. Wallace serves as the Director of External Relations for the COVID-19 Prevention Trials Network and HIV Vaccine Trials Network. He's a staff scientist in the Vaccine and Infectious Disease Division at Fred Hutchinson Cancer Center and a clinical assistant professor in the Department of Global Health at the University of Washington. Dr. Wallace, you have the floor.
Thank you. I guess I just want to start by talking a bit about COVID and HIV from a clinical perspective. We're still learning about this new novel or new coronavirus and COVID-19 and how it affects people living with HIV. Based on limited data, we believe that people with HIV who are on effective treatment have the same risk for COVID-19 as people who do not have HIV. Older adults and people of any age who have serious underlying medical conditions might be at increased risk for severe illness and complications with COVID-19. This includes people who have compromised or weakened immune systems. The risk for people with HIV getting very sick is greatest in persons who have low CD4 cell counts, as well as people who are not on effective HIV treatment. According to the CDC, currently treatment for COVID-19 is very limited. There's no evidence that any medicines used to treat HIV are effective against COVID-19, and people with HIV should not switch their HIV medicine in an attempt to prevent or treat COVID-19. There are many clinical trials that are taking place to look at whether HIV medications can treat COVID-19. Other trials are also considering the effectiveness of using different drugs to treat COVID-19 in people with HIV and to better understand how people living with HIV can manage COVID-19. Regarding treatment options, as I mentioned, no FDA-approved treatment medicines currently exist. Remdesivir, which is an investigational antiviral, gained emergency use authorization from the FDA in May of this year based on preliminary data showing a faster recovery time of patients who were hospitalized with severe COVID-19 disease. On the prevention side, there are no FDA-approved medicines in existence currently. And current clinical guidance suggests that people can prevent becoming sick by avoiding exposure to SARS-CoV-2, the virus that causes COVID-19 disease, and to practice standard prevention measures such as washing hands, wearing a mask, other face and nose coverings, physical distancing as much as possible, of course, to cover coughs and sneezes, and to clean and disinfect frequently touched surfaces. For people living with HIV, it is especially important that people eat well and try to eat a balanced diet, get sufficient sleep and rest, and of course, reduce stress as much as possible. On the research side, there are several initiatives underway to respond to COVID-19, including the COVID-19 Prevention Network, which was formed by NIAID, the National Institute of Allergy and Infectious Disease at the National Institutes of Health, to respond to this global pandemic, using the infectious disease expertise, the clinical trial and community engagement expertise of existing research networks and global partners. NIAID has directed the networks to address the pressing need for vaccines and monoclonal antibodies against SARS-CoV-2. Not all COVID-19 vaccine trials are happening through the COVID-19 Prevention Network. For persons who are interested in learning more, they can visit www.preventcovid.org. Thank you.
Thank you, Dr. Wallace, for laying the biomedical framework for us as it relates to HIV and COVID-19 co-infection, and the ways in which decades of previous research, particularly HIV and AIDS research, has informed the scientific community's current response to the novel coronavirus. However, those of us who do this work know that our responses to diseases like HIV and now COVID-19 must go beyond what we do at the laboratory bench and patient bedside, which you alluded to in your comments, Dr. Wallace. I'd like to now invite Ms. Rachel Klein to discuss this further. Rachel Klein is the Deputy Executive Director of the AIDS Institute, a nonpartisan advocacy organization working to increase access to health care for people living with or at risk of HIV or viral hepatitis infection. Rachel has spent more than 20 years working to remove federal health policy barriers to care for people with low incomes, disabilities, and chronic illness. Rachel directs the AIDS Institute's federal policy work and runs the organization's Washington, D.C. office. Ms. Klein, you have our attention. Thank you.
Thank you so much. I'm really pleased to be here with this very esteemed panel and with all of you to talk about this really important issue that is really facing all of us. We don't yet know the full impact of COVID-19 on people living with HIV or really any of us. I think what we do know right now is that the impact is significant and will be, both from a public health perspective and an economic perspective. This pandemic has, as we all know, has disrupted the course of our lives in 2020 and is likely to continue doing so for the immediate future. As we look into 2021 and what's going to be happening in our nation, obviously right now we're all thinking about elections and the implications those elections may or may not have for the COVID-19 response and for the fallout of the economic disaster that has really enveloped our nation. But what we need to really be thinking about, regardless of what happens with those elections, is what happens, what do we need to do as a nation to support all of the people whose lives have been disrupted, whose income streams have been disrupted, whose healthcare may or may not be disrupted. I'll talk more about that in a moment. And really absorb the full impact of what has happened to us over the course of this year. I want to remind us all that when we went into 2020, we were thinking about this in the HIV community as the beginning of a new initiative to end HIV, the HIV epidemic. There was a lot of excitement. There was a lot of planning going on about what new innovations we could be doing to make sure that we, increased access to prevention and really engaged people who may not have been engaged so far in adhering to treatments and just really reducing the impact of HIV on all of us. But instead, we've been battling a whole host of new barriers to prevention and treatment as a result of COVID-19. Those impacts have been individual and systemic. There was a survey of HIV programs recently that found that 90% of HIV prevention programs detailed staff to the COVID-19 response. 70% of Ryan White programs report challenges with staff detailing. Programs have had to adjust for social distancing and new safety precautions and really figure out how to continue serving patients during this time. And I think there are some silver linings to that I want to raise because there have been some real innovations in patient care over the course of this year. But at the same time, we're seeing lots of challenges with stretched resources and people losing access to the services and the safety net that they had come to rely on. And I think we still don't really know the full extent to which state and local budget shortfalls that are going to be coming in 2021 are going to be impacting HIV prevention and treatment programs. We also know that harm reduction programs have been severely cut back due to staffing, resource, safety concerns. And the CDC recently issued an alert that we should expect to see both viral hepatitis and HIV outbreaks as a result of those program constraints and the realities of the way that COVID-19 pandemic has impacted the country. So not only are we sort of not taking that leap forward, we may actually see some retrenchment. And we just need to be prepared for that. It doesn't mean that we can't eliminate HIV in the future. It just means we may have taken one step forward and 2 or 3 steps back that we're going to have to recover. So one of the upsides that I wanted to raise is that there have been some innovations in prevention and treatment. There's been really new broad access, expansion of access to telehealth, more interest and utilization of home testing kits for HIV. And we still have a lot to learn about how all of that can and should be adopted past the pandemic emergency into our overall healthcare system structure. And there, I should say, there are some mixed results with some people reporting that patients really like the convenience that telehealth offers and that there may be some impact on people showing up for appointments and having fewer missed appointments. But then there's also some feedback that patients really do like having that in-person contact with their providers and would prefer to go back to business as usual and getting healthcare in a provider's office and having the supports that those offices are able to provide as well. And there's a lot that we're going to have to figure out policy-wise about who can best access telehealth and under what circumstances and how do we pay for it and how do we make sure that there's equal access given the underlying structural issues that exist in our society. And I know Guillermo is going to touch on this a little bit more because not everybody has the same access to a computer and a camera as I do sitting here today talking with you. So there are lots of sort of exciting things. We also need to figure out, to the extent that people are using home testing kits to test for HIV, how to make sure that they have the right emotional supports and are able to get connected to care seamlessly if they are getting those results by themselves in their home. So there are some sort of upsides and some downsides, and there's a lot that we're going to have to filter through as we get past the pandemic and into our new normal reality. One other silver lining I wanted to raise is the way that COVID and the sense of emergency that surrounded it broke through the political stalemate in Congress. And we saw a slew of legislation with unprecedented amounts of money being appropriated to the COVID-19 response. There was a lot of support for social services that people really have needed and for healthcare to make sure that we minimize the strain on the system as a result of COVID-19. But we know that everything that has been done was not enough. And ultimately that stalemate has come back and we are unlikely to see further COVID stimulus from Congress before the election. And so again, that is going to compound a lot of the economic difficulties that people are facing. People have lost their jobs and don't have access to unemployment. People are losing their health insurance. There's incredible food insecurity. We're going to see a wave of evictions and bankruptcies as bills are piling up that people can't pay. And all of that we know is going to have an impact on HIV going forward, right? Because we know that in order to be really managing your HIV, you have to be able to know where your next meal is coming from. You have to be able to have stable housing. And so all of this is going to be very significant going forward. I wanted to just flag one other thing, which is that as we are dealing with the ramifications of the COVID-19 pandemic, all of the other issues that we were working on before haven't gone away. There are underlying enormous risks within the healthcare system, and people were already struggling to pay for their care. There are ongoing attacks from this administration on copay assistance that we know is so important for people living with HIV and people who would like to take PrEP to prevent HIV. That make it much more difficult, will make it much more difficult for them to afford those medications. We know that not every state has yet expanded Medicaid, and especially in the South, where there's disproportionate impact of HIV in those states. And we have a looming Supreme Court case about the Affordable Care Act that will be argued in November with a decision to come probably in May or June of 2021. And that means that in addition to all of the work that we want Congress to be doing to make sure that those social supports are available to people who are suffering as a result of the pandemic, they also need to be working on a backstop for all of the protections that the Affordable Care Act offered to people who are living with HIV or at risk thereof. And in the event that there is a decision from the Supreme Court that would really create a lot of chaos and upheaval in our system. So lots of issues that we will be addressing, I'm sure, together as we go forward. And I know that Guillermo's going to talk a lot more about some of those, the more specific impacts. But with that, I will go ahead and turn it back to you.
Thank you, Ms. Klein, for sounding the alarm, really, on the structural consequences of COVID-19 to ending the HIV epidemic, but also the importance of civic engagement around these issues of healthcare and public health infrastructure. One of the themes I heard in your comments is that at the foundation of the structural aspects of these COVID-19 and HIV intersections is how it resonates at the community level, but more specifically vulnerable communities, right? And populations of people whose lives are literally at stake. If we've learned anything from these dual pandemics is that these diseases are as much social as they are medical. And there are a few people better positioned to speak to these social dynamics than our final panelist, Guillermo Chacon, president of the Latino Commission on AIDS and founder of the Hispanic Health Network. Guillermo is a vocal advocate on the impact of HIV, viral hepatitis, and other sexually transmitted infections in Hispanic and Latinx communities. Under his leadership, the Commission has invested in national community mobilization programs to promote testing and linkage to care, nationwide capacity building programs, and developing non-traditional partnerships, especially investing in their regional work in the Southern United States and Puerto Rico. Guillermo, the floor is yours.
Thank you, Ulysses, and thank you all of us, for coming together and all the ones participating in this important leadership summit. I really wanna totally agree with my previous panelists' remarks. I would like to highlight a couple of issues from the social implications. As both Stefano and Rachel mentioned, we enter this global pandemic with many epidemics, right? The HIV epidemic heavily impacted African American, the most impacted. Don't forget that even though we are, when we talk about the global, the national impact, African Americans are the most impacted, particular men who have sex with men and Black women as well. And I think we need to sound the alarm. We were sounding the alarm for many years about that, and then this global pandemic hit us. Heavily impacted are also Hispanic Latinx, and we also have been sounding the alarm. And what this global pandemic hit us and exposed even bigger is the deeper health disparities that we have been facing. Plus, I think show us the structural racism that we have been dealing, that has been a major barrier for many of our communities to access healthcare. I think both Stefano and Rachel was giving us and reminding us that the challenge that we have in front of us is how to navigate and how to, even though in the middle of this crisis, create spaces, and we encourage at the state, city, county, and state level, because the bottom line is we know our communities and we must engage in order to respond to this issue. But when you talk about COVID also, you look that it's African Americans, Latinos, Native nations, and Anglos as well, but those three segments heavily impacted. When you look about DC, when you look Louisiana, and you look the population and the impact of cases and death, I think is a clear case for us to respond. Same thing when you look San Francisco, New York as a two good example for Latinx, and you will see the same situation, that the numbers, 29% of Latinos, for example, in New York City, and 34% of death related to COVID, remind us that we have a structural issue to address. Now, we closed 2020 with a census count that will shape priorities for the next 10 years. And we know that in some places we're still struggling. It was an effort to short the population count. And we know that that will have an impact on a very weak city, county, and state infrastructure. Because the other thing that I think from analyzing the social implications is that as a nation, we have not invested in public health, truly comprehensive and meaningful public health investment. And I think those are the issues that we need to begin to shape our agenda for the next 10 years that we cannot afford, because again, we're still in the middle of this global pandemic, but it's urgent for us as a communities of color also to understand and to take a main role, a central role to be visible and to be leading these issues that are impacting our communities. Since April, the Black AIDS Institute and the San Francisco Community Health Center that is led by an Asian man, a Black organization led by a Black woman, and yours truly, we create the Stronger Together partnership. We immediately begin to do an assessment nationwide on the impact on COVID, on community and community-based organization led by people of color. We're gonna do a think tank on October 14. And this is one of many other initiatives that we support. But I always believe that when we have a public health crisis, more than ever, we need to speak to each other. And that's the reason I love this opportunity that we can integrate thinking and develop new strategies. I think innovation is something that is a must these days. And we know that we know better, the people that are in this panel, and I'm sure many attending this leadership summit are committed to address the structural issues that are impacting. But also I want to remind the audience that the challenges that we have as we close 2020 are very consequential. And we need to address also, as I was mentioning before, the outcome of Census 2020. And why I'm saying this is because Rachel mentioned that will be at the Supreme Court a very core issue. Access to care, the Affordable Care Act will be revisited by the Supreme Court. And as we speak right now, we have over 10 states that have not expanded Medicaid. And some of them has been not really doing a good job to redesign Medicaid. And folks that are low income depend on Medicaid. And then you have other obstacles that also call for us to work together more than ever to address those issues in order to really develop and craft some solutions that will be meaningful for our communities. I also want to remind the audience that are participating today that one concern that we have is the growing older population living with HIV. That we know with COVID, as we were updated today, we're still on development some treatments, and we know that a vaccine is coming. But and then the communities of color, we need to also guarantee that we will not be pushed aside, that we will not be labeled as essential workers. And you look mostly Black and Latinos, Asians are heavily represented in those industries. But when we are impacted, the investment in terms of how to heal and how to bring relief is not there. Especially, when you look about Hispanic, Latinx, undocumented folks have been working hard, and all immigrants as a whole, and African American Blacks working hard in many industries that have been heavily impacted. And as a few months ago, I believe a month ago, close to $1 trillion was the deficit among all the local governments and had not been relieved yet. And I'm saying this because the social implications of all of that will only tell us that more than ever, again, I will say again, we need to create these spaces of people that are diverse across the board, every single segment, to come up with the best strategies. With that, I pass the mic to our esteemed moderator.
Wow, really important reflections, Guillermo. Thank you for bringing our conversation home, really, reminding us that this is about our ability, or our inability rather, to address the social determinants of health for Black and Indigenous people of color. We can have sound science and strong systems in place, but if those systems are fraught with inequality and disparity, then we fail. Um, Really looking forward to diving into deeper conversation after hearing each of your remarks. I want to go back to where we started, the genesis of our conversation, the biomedical aspects of HIV and COVID-19 co-infections. Um, Dr. Wallace, uh, one of the things that I heard you say was that um, people living with HIV who have access to life-sustaining treatment, research suggests are no more vulnerable or at risk for COVID-19 infection than any other person. Um, I think that signals the tremendous progress that we've made in the quest to end HIV as a public health crisis, in terms of making sure that people living with HIV have undetectable viral loads, and that they are, as a result, untransmittable. Um, but the common theme within that and within all of your comments was around access, right? And so people have to actually have access to those treatments in order for them to benefit from them. And so tell us regarding your work, how it is that both the HVTN, but also the COVIDBN are working to make sure that in the time of COVID-19, diverse populations, but particularly communities of color, have access to what many of us believe will be the solution, a vaccine, but also how you all are making sure that people living with HIV and other illnesses are not excluded from that process as well. Earlier this year, we heard of a particular vaccine company that was not allowing people living with HIV to enroll in clinical trials. And it was due to the strong advocacy from people like you all on this panel that they changed their tune quickly. And so tell us in your work how you're making sure that not only diverse ethnic and racial communities, but also people who present with diverse health profiles have access to what might be the solution out of COVID-19, and maybe even the avenue for which we can get back to 100% dealing with the HIV and AIDS pandemic. And I invite all of my panelists at this point. This is an open discussion, so feel free to take yourselves off of mute and jump in where you see fit.
Thank you for the question. I appreciate the remark about progress. I think I would characterize it as delicate progress, because as my co-panelists have so beautifully articulated, that the progress that we've seen is in jeopardy of being eroded from the implications of this pandemic. And in addition to people who are currently living with HIV and that they've already received a diagnosis, and ensuring that they get access to medications to ensure a lower viral load and their overall health in general, there's a consideration, as Rachel mentioned, about HIV testing. And so people, you know, we've known for years that there's been a percentage of people who are undiagnosed, who are also not just themselves not receiving support and medications and assistance and treatments, but they're also there are other people, by by virtue of them not knowing their status, that other infections are being caused by that. And so it's a cascade effect if you really think about it. And the impact of COVID on our already delicate and fragile healthcare system, and the public health infrastructure, I think, is important to really call out in response to your question as well. In terms of the research side, people who have compromised immune systems and otherwise what would be considered comorbidities are participating in the clinical trials for COVID-19. Like, these trials are open to people who have these very varied sort of health conditions that would under normal circumstances might preclude them from participating in a prevention trial. In part because we want to understand how the vaccines may or may not work and the antibodies may or may not work in these populations as well. And we also understand the relationship between these health conditions and the severe cases of COVID-19 leading up into death, that we've seen as a result of people who present with these. And so one is sort of, people of older age, older than 60, and people who have various health conditions that we're really looking for to join the COVID-19 trials. And this is across, race and ethnicity. But of course, we know that, as Guillermo mentioned, that COVID-19 and HIV have disparately impacted specific groups in this country, and that can't be lost on us either. And so I think what really COVID-19 has done is provided us another opportunity to get it right and to really respond from a community perspective, a provider perspective, and a policy perspective to ensure that we're resourcing public health in a way that adequately responds to these conditions, and also the other determinants of health that place people in communities in more vulnerable positions, not just for COVID, but also for HIV.
Absolutely. I want to stick with the theme of opportunity that you talked about. Um, Rachel mentioned this in her comments, saying that it's the first time that, people in policy and politics and otherwise have really kind of got on the same page around this issue. I've said many times that I've worked harder this year than I have in my previous 10 years of doing HIV and AIDS work because the entire world is working on COVID-19 at this time, right? Imagine if we had that same kind of energy for HIV and AIDS, maybe we would not be entering into the 40th year of this particular pandemic, right? But there's an opportunity there in terms of partnership, in terms of collaboration. And my hope is that one of the bright spots, if you can call it that, that comes out of these dual pandemics is that we coalesce better so that we can not only end COVID-19, but also keep to our promise to end HIV and AIDS as a public health crisis by 2030. Guillermo and Rachel, sticking with the theme of access, Rachel, you talked about the Affordable Care Act and what is before us politically and how that might impact vulnerable communities, both people impacted by HIV, but also more susceptible to COVID-19, which in our country tend to be the same groups of people. Our attendees might not be aware, but one of the hallmarks of the Affordable Care Act was that it exponentially increased the access to healthcare for people living with HIV, right? People who had an HIV diagnosis before were excluded from healthcare because their status in and of itself was considered a pre-existing condition, right? And so people had to become more sick in order to access health care that they needed to stay alive and to stay well. And so the Affordable Care Act removed that barrier. So tell us a little bit more about how the AIDS Institute is working on the policy side to make sure that those protections remain in place, because we also understand that those will be protections for people who are most vulnerable for COVID-19 and as well. And then what our attendees can be doing, whether it's voting, whether it's filling out their census, whether it's writing their politicians, to support the work that you all are doing and that Guillermo is doing and that Stefan is doing to make sure that these protections kind of remain in place.
Thank you so much. And you have outlined it so beautifully. I'm not sure that I have much to add because you really hit on the really key points here, which is that over the last 10 years, we've made incredible progress getting health coverage to people who were not able to get it before for a whole variety of reasons, because they couldn't afford it, because they were locked out because of pre-existing conditions, and because the Medicaid program didn't operate the way it does today on an income basis. You had to fall into a certain category and have very low income. And we've really, it's been a sea change in how health insurance works. And since health insurance in our country is your key to getting into the healthcare door, that's been really, really crucial. And we have this whole system now of sort of multiple working parts that work together to form that health coverage fabric. And if this case is decided in such a way that the Affordable Care Act goes away, it's going to be crucial for Congress to have a backstop, to have a sort of, in their back pocket, this is what will need to happen in order to make sure that there isn't sort of mass chaos in our system. There's going to have to be some timelines for what that decision means for Medicaid coverage, for insurance in the health insurance marketplaces, for what's going to happen to the Ryan White program if people who are getting their health care primarily in Medicaid right now are not able to do that in some states that where the Medicaid expansion might go away. And so what we're doing right now is sort of compiling working with a host of other organizations who have mutual interest in this area to sort of compile what are those key things that we need to make sure are protected. And how do we move forward once there is a new Congress in place, once we know which administration is going to be running the show? How do we move forward to make sure that those issues are at the fore of any of the debates that are going to move forward on the Hill? And I think you also raised some really important ways that people can take action right now to vote, call your member of Congress. This isn't on the floor today, but it never hurts to make your senator and your member of Congress aware of your feelings about the Affordable Care Act, about access to health care, and make sure that they know that their constituents care about this issue and that they will be held accountable for any decisions that they make when there are bills that are going to be voted on around this. So, and I again echo, fill out your census form. If you haven't yet, do it now. It will matter. It's one of those sort of things that we don't always understand the value of it. You keep seeing all these, ads on the, on the bus stops where you live, or you get an email, or you see this thing come in the mail, and it seems like it's a relatively minor thing, but it makes such an important difference to how all of these programs are run for the next 10 years. So I'll see if Guillermo has more to add on that front.
Yep, thank you both. I totally agree with Stefano and you, Rachel. And I want to also complement what you just said, how important it is to engage with our state legislative bodies, with our governors, And I told people, I say the city, county, state strategy must be not a 1 year strategy, but a 10-year, 5, 10-year strategy. I always remind folks that folks at the state legislative body shape, the health policies of your state. And then obviously the federal that you described very, very well, and Stefan also give us that macro perspective of research and development. We need to also put attention to that. The other piece that I want to remind, the audience is that how important is for us more than ever to make the decisions to expand, even though we're hard right now, hit hard, especially providers. We're very concerned, especially community-based organizations. Well, we see also we're dealing with an epidemic of hate crimes, homophobia and transphobia, and pure hate right now of people that look Asian, look like, that look Black, that look Latinos, a lot of tension, in terms of how police do their jobs. And we want to recognize every single institution, but when something is not right, it's not right. And we need to call it off, as it is. But again, in terms of our health needs, that is critical. And the other piece is how we step back and request, especially providers, to go deeper on the issue of diversity, equity, and inclusion. If your community advisory board do not have a trans person, if your community advisory board don't have a gay person, heterosexual person, etc., is not diverse enough and represent the community most impacted, we have a problem. We have a challenge. I don't like to use the word problem, but we have a challenge. And when we have a challenge, it's a call for, put our thinking caps and our work outfits to get ready to do anything that has to be done, because this is about our health, our future, and nothing more important than healthy communities. And COVID and all the epidemic, the HIV, the hepatitis, the STIs, is a reminder that we do not have healthy communities, and we cannot shape a future without that important core. And also, we need to protect, Ryan White programs. HRSA do an amazing job. CDC do their best on their very difficult, time in the last few years. But, CMS right now is ready to rule on some new issues that will impact the capacity for people to access care. And again, I always believe that when we have these opportunities, is reaffirm, at least, I'm sure for all of us, the power of coming together. Thank you.
Thank you, Guillermo. And that's a great segue into our question and answer portion of this event. So I'd like to now invite all attendees and viewers to dialogue with us with any questions you might have for our panel experts. Again, a reminder to participants to place your questions in the Q&A box and not the chat box, and I will present them to the panelists in the order in which they are received. We've already received one question, and Guillermo, I'm going to stay with you and invite any of our other panelists to chime in as well regarding how people are counted, regarding the census. The question is, how do we tackle questions on the census that miscount and otherwise bloat or overrepresent certain groups, that ethnic groups like Arabs and Iranians and others are often caught between classifications, and Hispanics and Latinx persons in particular are often forced to choose white and even, otherwise, and don't feel very white. And so maybe you can bring some clarification to the census in and of itself. I know there was a lot of controversy leading up to the census about particular questions that alienated certain groups of people. And I think it's also appropriate to mention that while we've focused on the Affordable Care Act, there are a lot of things that are vulnerable in this next cycle as it relates to the Supreme Court. And that includes the Affordable Care Act, that includes Roe versus Wade and maternity health, that includes marriage equality, which will impact many of the people living with HIV in this country. That includes immigration reform. And so tell us a bit about how you all are working in the grassroots to make sure that everyone is counted, but not just counted, that they're counted appropriately.
Yep. We need to break the invisibility of some communities. One thing that I'm proud to share with all of you, we joined the New York Immigration Coalition, and we belong to a bigger coalition of, working hard to ensure an amazing 2020 census count. But I think that Ulysses put it very clearly, it was very difficult, this count, because it's hard when somebody is in a daily basis attack the communities that you try to engage. When communities feel, they don't feel the trust to approach some key government sectors and some key institutions that are supposed to protect the general public and so on. And then one thing at the New York Immigration Coalition that we did immediately was to be mindful about to have the American Arab Association to be a core member and active, to have Latinx, to have immigrants from Africa, organizations, and Haitians, etc. Because if you're not in the picture, right, you're not there. And I always believe that the diversity is, you have to see it. You cannot just speak about it. You have to show it. And I still I know that was a big push to trying to basically reduce the days and so on, but we still a little time, and all of us, the count is for the entire population. No one in any place is talking about just one segment of the population. And I think we will need to deal with this with the new Congress that will be elected this coming November, or taking the new turn in January, because it's so many things that this year we will remember, not only for COVID and changing, the way that we will used to, engage and interact, but also change and impact so many issues that is our lives, on the line here, and at least, political representation and federal distribution of funds for the next 10 years.
Absolutely. That's a great dovetail into the next question regarding any recommendations that you all can offer around policy changes at the local, state, and federal levels that will help both those dealing with HIV and the COVID-19 pandemic. And maybe Rachel, you can speak more to this. Is there anything that we should be advocating for specifically to our local, state, and federal legislatures? Whether it is the Maintenance of Affordable Care Act or other more specific statewide apparatus to maintain the health and wellness of people most vulnerable for these dual pandemics.
Yeah, I mean, there's so many things, right? I feel like right now we all get a little overwhelmed, right? Because you turn on Twitter, or you go to your local paper, or you turn on the news, and it feels like it's overwhelming how much there is to do. And I would really urge calls to your members of Congress and your senators right now. Let them know that we need them to engage in, particularly your senators, in that next round of COVID stimulus bill that the House has now passed 2 versions of. There have been negotiations between the administration and the House leadership, and the Senate's really kind of been standing by, and that's the reason that it's not happened yet. And in that package, there are so many things that are addressed, from more funding for the SNAP program to address some of the food insecurity, to to more stimulus funding for individuals, like that $1,200 check that many people got earlier in the year, extension of unemployment benefits, right? There's a lot that is at stake right now that will help people both in the short term and the long term, because I think what we need to remember is that, people who can't make their rent payments today and aren't being evicted, they're getting more and more bills. And if they can't pay for their utilities and they can't put food on the table, those things are adding up. And it's going to mean that down the line, it's going to be that much harder for those individuals to be digging out, because their credit rating is going to be affected, and it's going to make it that much harder for them going forward. And so getting that stimulus package passed, I would say, is the first, second, and third thing I would focus on. At the local and state level, there's a lot of things that state legislatures could do if Congress isn't doing them. State legislatures could enact eviction moratoria. They can do supplemental unemployment insurance. There's a lot of things they can do. They're a little hamstrung because the state budgets are really impacted by COVID, and states have to balance their budgets every year. So I think while states sort of have that ability, the thing that your state legislators and your local officials can do is weigh in with Congress, because they're the ones who really have access to the funding that's needed to support our social safety net and provide that assistance that people need right now today. I know there's a whole host of other things that we could talk about, including mask wearing and outreach and education about vaccines, because one of the concerns I have is that misinformation and what some would say is a very healthy skepticism of the vaccine development process will make it less likely that people will volunteer to take the vaccine once it is approved for COVID. And we want to make sure that people get vaccinated with a safe, effective vaccine once that is approved, because that is the way that we're really going to, get ourselves out of this emergency and to a healthier, safer place.
Yeah, I want to bring
So
Dr.
there's
Wallace
so much.
into the conversation, particularly around your last comments in terms of access to a vaccine, but also confidence in the vaccine that is available, right? Dr. Wallace, I know that the COVID Prevention Network is taking some unprecedented measures to make sure that people, specifically vulnerable communities, have access to education and information around vaccine science. Tell us a little bit more about the ways in which you all are ensuring that the people who need the information the most are receiving it, but also to the last question in terms of policy and what people can be advocating for. Tell us who should have access to the vaccine first, if it's available, and if it's something that we need to be pushing our government officials on to ensure that those who need it can get it without having to worry about cost or safety or any of those other measures. And this will be our final response, and then we'll close out.
Well, that was a lot, but I can, thank you for that question. There are quite a few things that are happening in the COVID-PN. At the clinical trial site level, there are engagement and education activities that the sites are doing in their local areas, connecting with community partners, faith-based groups and organizations, and advocacy groups to help share information about what's happening in the clinical trials. And also in partnership with the community advisory boards of those clinical trial sites to ensure that they're adequately engaged and informed and are sharing information as well. So it's not just coming from the trial site staff, but also from the community, the CAB members who are associated with the clinical trial site. At the network level, there's a ton of activities that are happening. I guess just to highlight a few, we have expert panels as part of the COVID-PN, and these panels are comprised of scientists who are not a part of the clinical trials themselves. These individuals represent disciplines such as social and behavioral science, bioethics, as well as immunology and vaccinology. And these persons have come together and organized in order to help review the study materials, the protocols, and provide feedback and ethical considerations to the trials that are happening. I would also say that these persons represent different diverse groups. So there's an expert panel for Black African Americans, for Latinx persons, for Native American, American Indian, Alaska Native persons, and for older adults. And each of these panels, again, are comprised of folks who not just have experience researching and doing clinical work in these communities, but they're also representatives and members of those populations. Another strategy is to, of course, expand on our community partner network. So we have relationships with community partners around the country, including our very own Guillermo with the Latino Commission on AIDS, who we partner with in order to host education sessions. And, you know, in some of these sessions, we've also hosted them in other languages to make them more accessible to communities as well. And part of the point of these sessions is to provide information to communities about what's happening, how, you know, what are the issues that people are hearing on the ground, and how can we reframe those issues and provide, you know, information to communities to consider. Obviously, all of this is with the goal of not, you know, pressuring or persuading people to join clinical trials, but really to encourage them and to get them to think about this differently. You know, one of the things that we often talk about is the Belmont Report, and, you know, in tandem with the conversation is around historical abuses in specific communities regarding research and medicine. So there have been some advances that have been made, but in addition to those advances, it's important that we, particularly communities that are underrepresented, to be involved so that we can continue to hold the ethical perspective and consideration as science continues to move forward. So I think that that answers sort of the first part of the question. Those are just a few of the strategies. There's many more that I could share, and we would probably be on here for another 30 minutes or so talking about them. The other thing is about the, you know, who should have access to the vaccines. You know, that is a complicated question that I know many people have opinions about. The National Academy of Medicine recently released a report and a framework that provides some specifics around this that I would encourage people to check out and read. It's a free publication. But I think that, you know, I wouldn't be me as a person and as an advocate in communities if I didn't say that the communities that are most impacted should be prioritized in the distribution. You know, and that to me is a function of just, you know, public health and sort of how do we care for those who are most impacted? And I think that we need to really look at that and consider how to make that happen. But of course, the conundrum for many will also be how do we also bring people along and partner with communities in the science and the distribution process in a way that encourages and enhances trust, so that people would be acceptable of the vaccine in the process. So there's quite a few moving pieces going on with respect to, I think, an answer to your question, because it's a layered question for sure.
Absolutely. Thank you. On that note, let me thank the National Minority Quality Forum for hosting this informative summit. A special word of gratitude to each of our expert panelists who have given both their time and their talent today. And of course, a big thank you to each and every attendee for your attention. If you had a question that didn't get addressed or answered, you can email Keiko Purnell, who has put her information in the chat box. Otherwise, I invite you to join the next webinar on maternal mortality that is happening immediately following the conclusion of this one. Thanks to everyone. Be safe and stay healthy.